Is there a higher chance of strokes in particular genders?
If you delay and you give that treatment, the brain may bleed because you're using a clot dissolving drug, which increases your bleeding.
But if your lifestyle is such that you're drinking and smoking every day, can a young person get a stroke?
Stroke is the second leading cause of death.
Are people as aware about these kind of strokes in rural areas?
We teach them how to identify a stroke using the acronym of FAST.
A clot that is getting formed in your brain, but when you have opium, because it's a blood thinner.
So in general, all across the world, men have higher incidence of stroke.
If one of the family members is getting a stroke, you just don't know what's happening, right? So how do you know it's a stroke, and how should a family member take care of it immediately? Is there any first aid that can be given by the time we get to the hospital? Can you talk to us a little bit
That's
about
the most pertinent thing that you have asked about stroke, because that is the biggest thing people want to know.
Right.
So the first thing, which again has been prevalent from the era of 90s and 2000, is the identification of a stroke, which has not changed much. And we use the acronym of FAST.
Right.
And that must have heard of. Everybody's now heard of FAST. It's become so popular, but back in 2000s, it was not as popular. So we tell the public, as well as the hospital staff, even the nurses, we teach them how to identify a stroke using the acronym of FAST, and later it became BEFAST.
Okay.
FAST means F is face. If you have a face which is getting, paralyzed, or you have some asymmetry of the face. Arms, A for arms, if you're getting weakness of the arms. S for speech, if your speech is getting blurry or changed. T is time. You do not have time. Rush to the hospital. So remember these four things. If you have face, arm, speech, don't waste time. Take the patient to the hospital. And this has been now added for an improved sensitivity. You call it BEFAST, which is B is balance. If you're losing balance, E is eyes. So if you have double vision or anything going wrong with the eyes, and FAST. So that, because these symptoms are missed in the earlier FAST.
Correct. Yeah, I mean, it makes sense that you would miss that your body is not balancing itself straight, and sometimes you can totally miss that, your vision is not clear. Sometimes you just think that, just maybe I'm tired, or like something like that is happening. So are these two like the very early signs of a stroke?
And if they happen suddenly. So suddenness is the key. If these things happen to you like a bolt from the blue, which a stroke means, you should rush to the hospital. At least be sure you're not missing out on a stroke. And why is it important? Because the time is most important. The more you delay reaching the hospital, the lesser are the chances of you improving with stroke. So you need to earlier, we just had a window period of 3 hours. In 96, the drug was tested to be effective in 3 hours. So imagine 3 hours means you need to reach from home to the hospital and start the treatment. How many people reached? Hardly any. Still is the case. So gradually, slowly, the research evolved, the systems evolved. It took 15 years from 1996 to 2007 or 8 for the window period to enhance from 3 to 4.5 hours by continuous research. So the same drug could now be used at 4.5 hours safely. The fear is, if you delay and you give that treatment, the brain may bleed because you're using a clot dissolving drug, which increases your bleeding. So you need to be very critical.
So you have to be very precise about the time also.
Oh, yes.
So, but sometimes won't there be patients who've not taken a note of the time, and they wouldn't know when exactly they got the stroke? So how do you deal with situations
Very
that?
correct. That's a very, 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 I would say, again, a very specific and a pointed question. In fact, that's one thing which we fear, that patient or the attendant would not know when the stroke happened.
Yeah, because you're obviously not looking at the time, then you're panicking like that.
Yes.
You're like, oh wow,
So things are not so, not that difficult if it's happened during the day. Because, during the day, there'll be some cue.
Yeah.
Somebody would have met you, when you are awake.
Correct.
There are people around you in the daytime. And somebody would have talked to you, so you get clues. Somebody would say, I had last seen this person well at, say, 12 p.m. So we take proximity, okay, we know the time. The worst is, if it happens in sleep,
Right.
you won't know the time. So that's called stroke of unknown onset of time, you know. So that is a big fear because the stroke onset time, as per the convention, is taken as the last time somebody was seen well. For example, if you had a stroke in sleep, I would take the sleep onset by convention as the time you slept off. That was 10 p.m. in the past, in the last night. So that is a hard time, but now we have protocols even to treat those. So, and the evolved treatments which have happened over the years till 2016. So it took another, I would say, 8 years from 2008 to 16 for the next step of the treatment, which was intervention. So now we have the capability, like the cardiologists, we can get inside the brain, remove the clot, and take it out through a catheter, just like you see in the coronaries, what people did in the heart. So now we can do it for the brain. And this has extended our window period to up to 24 hours.
Oh, wow. Okay.
Yes. But the drug which is given as intravenous infusion, that still has to be given within 4.5 hours. And that usually is the case if the patient who reaches within 4.5 hours should be first treated with the drug. And if there is still a clot left in the brain, then they put the catheter and then remove it. This has been the biggest sea change which has happened in the last, say, 8 years now. It was a big thing for, stroke treatments treatments in neurology. One of the biggest game changer, as we call it, since not only did it offer an opportunity for the brain to be saved within a window period of 24 hours, which is way more than 4 hours, 4.5 hours, but another big opportunity for neurologists to get trained. So this started a new field, the field of neuro-intervention. So now what we were like armchair neurologists, from armchair we were on the, on our toes. It's all the time. Yeah. So the people who get trained, since it's got advantages in all manners, it's well paying as well as it saves a lot of lives. So a lot of doctors prefer now, a lot of neurologists prefer to go into neuro-intervention, after they finish their DM neurology. In fact, when I finished my DM, I had this big dream I would be an interventionist, but that time there was no intervention. And they were hardly, because I would always dream that, if the cardiologist can go into the heart and do it themselves, why not us neurologists? But it took 20 years, almost 15 years to 20 years to develop that from the time I finished my neurology for this thing to be developed and then, of course, trained. And then I thought I'm good with what I'm doing. So we started our stroke systems with IV, and now the interventionists, at least in a lot of hospitals, it is a neurologist who does the entire treatment, which is start the treatment with IV, which can even be done by nurses. So we train our nurses to do that. Identify a stroke and he will start the treatment, of course, under supervision of the doctor. And followed by that, you have interventionists who can remove the clot. That's an important thing which people should know, that if you're getting a stroke, they should reach well within the time. And these are treatments which are approved and are very effective. Now, a lot of times patients do reach us and they make so many delays. A lot of patients whom we tell this is the treatment, but there is a risk involved in all treatments.
Correct.
And but a lot of times patients tend to delay things. They want to talk to their families, and that sometimes takes away the golden period or period.
Yes.
And
that's do the doctors not suggest at that time that, okay, like this is the golden period, and if you miss it, that's it. It's like you're not going to be able to save the patient.
We do tell them, but there would be patients who would want a second opinion, a third opinion. So this is something which, because of lack of awareness. So if the awareness is there and they know, but there will be on the other end, there are patients who reach the hospital in time. They say we want the treatment. They know about the treatment and they say we need to get that treatment. And that's the other thing which doctors had to do, now also continue doing, is the improvement in public awareness. So we ourselves did huge programs over the past 10-15 years. We were very, very aggressive in, educating the public on what the stroke is. So we were right at the time when we started, for example, in 2001 or 2, we launched the program, and we were highly, aggressive in launching programs. At least what we could do is within the city about making people aware of stroke. So that's another story which we did, but makes a difference over the
Of course.
long run. And people have to be continuously doing the awareness. However, now I would say that there is a lot of awareness, at least in cities like Chandigarh, where people do know that there are stroke treatments available.
Yeah, and what about rural areas? You said that you're doing it in cities, but are people as aware about these kind of strokes in rural areas?
Unfortunately, not. Because, we are a diverse country. India is a huge diverse country with different kind of people in different kind of, setups. And the rural setup is unique in a way that they have their own cultural beliefs.
Oh, yeah.
That makes a huge lot of difference in the treatments they seek and and what kind of treatments they seek. So one common practice, I'll give you an example to that, which is quite interesting, is in Punjab.
Okay.
So in Punjab, a big practice and a very, very prevalent myth is if somebody gets a stroke, which then they can identify as stroke, they call it adhrang, that they have on-site weakness. So anybody who gets an adhrang in Punjab will be given opium.
Yes.
Yeah, you also know that.
Yeah, I know that. I know they say if you think you're getting a heart attack or if you're getting a stroke, just put some opium in someone's mouth and they will get saved.
You also know.
Yeah, I also know that, yes.
That's a myth.
Really?
Of course, there's no science behind that.
No, but is it effective?
No, it's not effective.
Like-
when you don't have, in science, if you don't have a proof, if you don't have a study, it may be, but we still don't have any study to prove that.
Because they say that, when you're getting a stroke, there's a clot that is getting formed in your brain. But when you have opium, because it's a blood thinner, that's what is said. That because it's a blood thinner, it helps with the stroke.
Like you said, it's said. But that's
Yeah.
all of these are things which have traversed generations as a myth.
Correct.
Who's trying to prove it? Nobody's proven it. And the other downside to it is strokes are of two types, not just a clot. The other serious kind of a stroke is a hemorrhage.
Okay.
Strokes happen because of either a clot goes into the brain or an artery bursts. The blood pressure is high. But that's the less common one. The 20% strokes happen due to the artery bursting. So if you give opium to that guy, so-called, if that is a blood thinner, that's going to get worse.
But what is the difference? As in, is the artery bursting because of stress or something?
Yeah, hypertension.
Hypertension.
So that is the reason we first need to do a CT scan. That apart, let's talk about the opium.
Yes.
Opium.
Yeah.
So a lot of patients, when they come to reach the emergency, they say, oh, we've already given opium, so he'll be fine. They don't understand this. So the few percentage of patients who probably get okay with opium are just by chance. That's what we believe. And there's something called a TIA or a transient ischemic attack. A lot of strokes, they have a prelude in terms of a temporary weakness, which may last for minutes to seconds.
Okay.
Right? And a few days before the stroke or a week or 2 weeks before the stroke, you may get something called a TIA.
So it's like a mini stroke.
Mini stroke. So that, it's okay on its own, but that doesn't mean you're safe. That is a warning sign that somebody should go to the doctor. A lot of these strokes will probably get okay, very okay, TIAs, that's what we believe. Because there is no proof. See, myth is something which you don't have a scientific validity or a proof.
But I know, since all these doctors are doing so much research, and if these people believe that, opium can, is there any doctor who is researching the effect of opium on stroke?
Opioids, if you know, opium is part of the opioid groups.
Right.
We know opium has its own place in the body,
Right.
called the receptors, and these are usually painkillers. We use morphine for relief of pain. But there has been no such thing, I'm not aware of, at least if there is. Studies, yes, you're right. In fact, I've had this talk with my colleagues that let's try the study, but it's not easy to do with planning. We might need to start with an animal model,
Okay.
which takes another 10-15 years. But rightly said, it should be proven once and for all to debunk the myth.
Correct. Yeah.
Debunking, that's what is more important.
Exactly. at least you can then prove to people that, okay, this is not true, because until it's proven right or wrong, they're still going to keep doing it. So until they are given proof that, okay, this is not something that works, they're going to still keep doing it, because I think as Indians, we have just the culture of trying to try desi nuske all the time for everything. Like every grandmother has a remedy for everything, and doctors are only consulted after the desi nuskes don't work. So if we are able to debunk that, this desi nuska is not going to work, and like the dadis should not do it,
Yes.
only then, we have some hope of people not going further.
That's an excellent idea. In fact, something which also I vouch for the same thing, and we were in plans to do it, but it's kind of complicated. But we might, as you suggested, try to do that. This myth is only unique to North India.
I know. Because
Punjab.
Punjab is known for...
Yes. So in fact, the surprising part is if somebody in the village is getting a stroke, somebody would be would be a good Samaritan to offer free opium. To that guy, oh, you take it from me. Give it. That's all the stories that we've heard, that they don't mind giving that, pinch of opium to the other guy who's having a stroke. But all said and done, that delays things. They give the opium, then they keep waiting, and this is going to get okay till the time they don't get, then the patient doesn't get okay, they get him to the hospital. So they've lost that window period. So we try to tell them, okay, one is, don't be so sure about this. Get the patient. This is one thing which the rural areas should start understanding, that they should start getting the patients right on time. And rural, like you said, so we don't have well-developed stroke systems of care. For example, in the US, they have primary health systems or primary stroke centers, which would identify a stroke, and maybe they would also have the capability of, for example, if you talk of a primary health center. In India, primary health center has no capability. They don't have a CT scan. And to start a treatment in stroke, you need a CT scan. So the closest place a CT scan would be there would be a district hospital. For example, you have Sector 16 General Hospital. So they have a CT scan. So the availability of a CT scan is the key to the treatment for a stroke. So if it would be available in rural areas and our governments, I think they need to work in this step, the next step, where a single primary stroke center should be available in the village or a rural area where they can identify a stroke and maybe also treat a stroke right there. Till that time doesn't happen, we would have under treatments of stroke in the rural areas.
Right. And for the people who do have opium, is there another process that needs to be followed to take out the opium from their system first? Or you can just...
Since we don't believe in the fact that there is a blood thinner.
Right.
We're not sure of that. So opium, probably, I'll tell you the reason why opium and how opium works. So is it reduces your anxiety. You use opium, morphine in in heart attacks.
Right.
It's one of the treatments.
Correct.
If somebody who lands to you in the CCU and he's got severe chest pain, with the chest pain, your blood pressure rises.
Right.
Your heart starts working more. So morphine is actually injected. It works two ways. It reduces your pain, relaxes you, and that's considered to be life-saving. Morphine is life-saving. But there, you're right. So this myth has a scientific basis, but over there it's different. It's to relieve the pain, relieve the stress, and put the heart to rest. Here there's nothing pain. There's no pain in stroke, in a brain stroke. So that part is kind of very paradoxical, that yes, we do use morphine in acute heart attacks, MIs, but not in stroke. So like we discussed, we don't have to really be bothered about the opium that was taken. It's not got a blood thinning effect, at least in the heart side. That's what we believe it doesn't have. So maybe it relaxes the patient, and that's why they think, and that relaxation possibly works in some way in making them believe that the symptoms have gone. But that's not a fact.
But do you know of any patients who have actually come to the hospital and they've been like, no, that person got fine from opium?
The transient attacks. So many of them come, they say he's partially okay. They don't get completely okay. And then they don't want to get the treatment. We usually get okay. There are quite a few patients who may not take the treatment, thinking that the opium is working. Mm-hmm. And that's beyond that.
So they take more opium then?
No. They don't. We tell them that this is not going to work. Because you need to put them on other treatments.
Should they believe you?
Oh, well, they have to. Yeah. People who don't believe will get discharged. Yes. So what happens is, there's another myth in stroke, which is a very sad thing, There are some, local centers around periphery of cities. Every city will have that, where there are some faith healers or what we call as quacks. So there's a big quack. I won't name it right now, but there's a big quack center, as we call it.
Okay. Oh, I know. I think I know what you're talking about.
Yes, a lot of people know about it. It's a very famous center. It's probably more famous than PGI.
Yes,
And
yes.
all patients of stroke who come to PGI want to go there. They say, okay, we don't want treatment from you. We want to go there. And uh, more often than not, a lot of those patients come back to us after months because they didn't improve, of course. See, strokes are treated, it's a science. You have to treat it at that time, or then it is all rehabilitation.
Right.
So they don't offer rehabilitation. They'll offer some medication which has no basis, some infusions which nobody knows what they're offering or treating. So some of the strokes naturally get okay. But that doesn't mean they have the perfect treatment. And they probably vouch on that, everybody knows, the quacks know the smart way to get out of those things. That every disease has some natural treatment. So once the natural treatment is there, they may naturally improve. So that doesn't mean that treatment is working, but there is a big belief. So these beliefs and myths, these are something which plague our population and our mind, especially in the rural areas or the suburban areas. So these are the people who are very difficult to convince, and they would leave PGI to go to that place, and there is no regulatory stuff, or the government doesn't clamp down on them. Those are some things which really harm the population, I believe.
Is there a higher chance of strokes in particular genders? Like, is there a higher chance of stroke in women versus men? And what is the reason for that?
Yeah, great question. Actually, the stroke is higher in men.
Okay.
Yes. Women are somewhat protected because of, in fact, they are protected till menopause.
Till menopause.
Till menopause. After menopause, the risk almost equates that of men. So the hormonal differences in men and women are protective. First, that is the reason they're protected. So in general, all across the world, men have higher incidence of stroke. However, the interesting part is, the World Stroke Organization, which is the biggest organization of stroke, does give us, we have a World Stroke Day every year on 29th of October. So we have slogans and themes every year to disseminate as educational campaigns. So years back, they had, a theme on women in stroke. And the reason was, it was found that all across the world, it is women who still have a very significant risk of stroke, but it is the women who are most ignored. That was a fact. Women are the least likely to be taken to a hospital. Women would be least likely to get the proper treatment or access to a stroke. And this is true for all over the world.
But why is that?
For some reason, these are facts emerging from research.
Is it because the signs in women are different?
No,
Signs
it's because of social things. Usually it's social. A woman this was what was found, that probably a woman having a stroke would likely not be taken to the hospital. They'll treat them at home. Or a woman herself would be, they're family makers traditionally. They're the center of the nidus of the family. They would ignore the symptoms, and that's very common. Women in India especially, or even in certain countries, certain cultures. Those were facts, and that's one year I remember we focused on women and stroke. We went to girls' colleges, girls' schools, trying to tell them how important it is to know and tell their families that women are also at risk of stroke.
Right.
But like you said, men have a higher risk, and of course, there are certain populations within men, for example, the Africans in the West, they are at higher risk. And those people who have higher risk factors like hypertension, diabetes, which is showcased in Punjab and in India.
Right.
Punjab has a very high incidence of diabetes and hypertension.
Yeah, India itself is like the diabetes capital of the world. Exactly. So it makes sense that is it related to strokes? Like, how is diabetes related?
Oh, directly. So these are all risk factors which relate to all the atherosclerotic diseases. So atherosclerotic leads to cholesterol buildup in your arteries. So the same risk factors which work for your heart work for your brain. So the same risk factors like diabetes, hypertension, smoking, alcohol, lack of exercise. These are all the risk factors which are also significantly responsible for your stroke also. So if the people don't control their risk factors, they are at a higher risk of having a stroke. That adds on to the risk. So that's pretty usual. And this is also what we tell them when you ask about how to prevent a stroke.
Right.
This is the way to prevent a stroke, is to take care of your risk factors. A good lifestyle. Most importantly, what you've been probably, of changes, the social change which is happening in our country is the Western lifestyle.
Right. Yeah.
Bad food, no exercise, junk food. So all these things, drugs at an early age, smoking at an early age, all these are getting complicated and bringing about changes in our country.
So you're talking about smoking at an early age. Does that also mean that young people are at a risk of strokes? Because usually you hear about a stroke and you think of an old person, right? But if your lifestyle is such that you're drinking and smoking every day, can a young person get a stroke?
Of course. Young strokes are extremely common, especially in our country.
Really?
Young stroke below 45 years, yes. So the common picture that you get of an elderly having a stroke is no longer a fact. Younger strokes are very common. In fact, day in and day out, we see strokes happening in young individuals. However, the percentage of strokes due to smoking and would be smaller. There are most of the strokes which happen in the young are due to some other factors which are not happening, or we have unknown causes. They may be genetic causes, or they may have a problem in their heart by which they throw a clot in the brain. Although, of course, these factors are important of smoking, of a bad lifestyle. There are, of course, a good number, but majority of them in the young are due to clotting disturbances in their blood, as we call a prothrombotic or a higher capacity to clot within the blood. So they have a natural tendency of the blood to clot. It's a genetic defect they have. But
And can that be detected if it's a genetic effect? Can you get some tests done to know beforehand that these are the kind of genes that I have? Because
so that is that's a futuristic question.
yeah.
Still date, we are not into the practice of detecting all your genes at birth. There was a big question years back that somebody who's born will get their entire gene. It's possible, although now I think this may start. People who are concerned, if you are born, your blood we can do the full genome now.
Yes.
Which was a dream maybe a decade back.
Yeah, because they do that now with parents. So when you conceive a child, you can get your gene testing done just to make sure that, you don't have any bad genes that you're going to pass on to the kids. And if you do, if I have a bad gene and my husband has a bad gene and they collide, then they say that, your child is at a higher risk of having this genetic disorder. So you have to take care of it from the very beginning.
True. So that is a fact. But strokes, till now, the strokes do not have a single gene. It's a mix of a number of genes, right? Like you say, a polygenic inheritance of certain strokes. So it's very difficult really to predict about a stroke. Yes, maybe in a child who has a strong risk factor, like a family history of strokes, that case it would be relevant. For example, there's a family who has number of strokes in the family or heart attacks, especially at a younger age. It would be really relevant and pertinent to carry out that testing in a child at a young age, so that you know that this patient or person or child is at risk, and you could possibly start treatment. You're quite right in that, because we don't do that currently. That is not being done. In fact, this would be an interesting thing to look into.
Yeah. And what are the other lifestyle changes that someone should make if they know that, that these are the things that can cause a stroke? What is a ideal lifestyle that should be followed?
Well, ideal is more easier said than done.
Of course. But I mean, if we tell people 10 things, maybe they'll follow 5.
Yes.
You know,
You're right. 50% is a good acceptable.
Exactly.
You do that in medicine too.
right.
If we implement a system, even if I get 50% results, I'm happy with that. Then we try to get it to 80%. But
Yeah.
so good lifestyle, as is well understood. We tell everybody offhand regular exercise. So of course there could be grades of exercise, but most importantly, healthy eating. Eating is the biggest. What goes in.
You are what you eat.
Yes, you are what you eat, and what goes in comes out. So if you eat unhealthy diet, for example, this is a traditional classical, explanation being given. India had a very good dietary,
Yeah.
I would say,
Balanced
traditional
diet. Yeah.
Traditionally, we had everything made fresh.
Right.
All your ingredients of Indian food are made fresh, right? From foodie to everything.
And they're organic. I mean, traditionally everyone would get their produce from like sabzi mandi.
Exactly.
Farmers.
It's what happened over the years. You all dependent upon Western foods,
Yeah.
Western pre-made, and everybody now, thanks to the social media, understands about preservative levels. So everything that you pick up from the shelves, right from your cereal, which is the worst thing to eat,
Yeah.
is full of preservatives and sugars. This is something which India never had, high sugar content. And this is what the West suffered. West has, despite everything, they have highly developed medicine systems, but they also have high incidences of all the atherosclerotic disease. This is because of their foods.
Yeah, I mean, they technically put their diseases on shelves of all their, grocery stores. Yeah, like.
So it's believed that it's all I don't know if that's true or not, but it's like, of course, it's the economic model that everybody has to sell their stuff. But comes along with that is the risk of disease. Taste is not always good. Taste is not always what one should follow.
Right.
So good tasting things are not good in the long run. So this is exactly what I think a good healthy diet, which means a lot of fresh fruits and vegetables, which has been epidemiologically proven to reduce stroke. Every day your diet should constitute a good portion of fruits and vegetable. A balanced diet is more important, where you eat enough of fruit,
Right.
vegetables, restrict your oils, and maybe have an early dinner. That's, I think, a good practice to have an early dinner. In our culture, we have heavy dinners.
Butter chicken.
So heavy dinners, late dinners.
Butter chicken
Yes.
leading to strokes.
Of course they do, because there's a lot of water in them. That sticks on to you, because the way to remember it is, if you're going to have a late dinner, you're going to sleep after that. Well, that is going to stick to your system. You won't have the time to metabolize it. So those things, and apart from that, I think the biggest thing which is lacking in our daily routine, which is different from people in the West, is exercise. A daily exercise should be a part of your routine. Whatever time of the day, people should take out time for exercise.
Yeah, I think we adapt all the bad things from the West, but we hesitate so much in adapting all the good. Like, we've adapted all the alcohol and the smoking, but we've not adapted like the amount of exercise that they're doing over there.
Exactly.
Yeah.
That is now coming a big thing in the West, to have exercise at all. That is because, they probably, we can blame them for creating diseases, but also they do research in these things, and then that's implemented. So, for example, interestingly, if you look at the epidemiology of stroke is the second leading cause of death in the world, right? And back in 2000, before 2005, stroke was the third leading cause of death in the US alone. If you took US, over the years, they made effective changes in their programs and their systems. From third, it went to fourth in 2008. Now it is the fifth leading cause.
Wow.
So see, they've really worked hard on that.
Correct.
And the biggest change that they made in their system. So their health systems are organized in the West, for example. So anything which is passed on goes on to the population. So the first thing that they did was reducing salt intake. So, that is popularized. Tell people to reduce their salt intake.
So that's a lifestyle change that everyone can make.
So one thing which made a change in their hypertension statistics in the US and stroke, I think, was reducing their salt intake. And it's interesting to see we look at world data on one side and US data on the other side. So US is now actively, they've brought down the stroke to fifth leading cause. And look at us. We are now the second leading cause of death. And we are probably going to be leading the stroke population of the world by another 10 years, by 2030.
If we don't make any changes.
Yes, if we go by the way we are going. And we have already exceeded the population of China.
Right.
We are the number one most populous country right now. And if you don't look at our risk factors, we are going to have a very high incidence of. So having a stroke is not the problem. But the problem is you're left with a disability. And your disability means there's somebody who needs to take care of you.
Yeah.
Right? And that's a burden on the family and the society. That's the entire reason we need to prevent a stroke. Because when somebody has a stroke, the whole society gets affected. And that is one thing which people should start understanding why it's important for a person who maybe that's one of the reasons we try to educate. We have attempted that, but it's not as successful as to educate children at a young level in their school so they can go back home and tell their parents and their grandparents.
Right. And nowadays there are a lot of cases where you hear that someone was in the gym and they got a stroke. But do you think the vaccine has something to do with that?
No. So that's another story. You're right. That's one common question we are always asked.
Yeah.
I would not rate that vaccine is totally what. That's a myth. We don't believe in it. So vaccine caused only one major thing. That was thrombosis, which was again a very rare episode of one of the vaccines.
And what exactly is it?
That was vaccine-induced thrombotic thrombosis. It was basically a rare kind of a thrombosis which causes an antibody reaction in the body and leads on to a thrombosis of the blood vessels, mainly in the brain, and it was in fact associated with brain as well as in the rest of the body. But that's rare. That doesn't mean the strokes are happening because of that. So strokes in the young are not due to the vaccine. I'm pretty sure of that. Because vaccine was given, say, 40 years back. People are dying now. That we don't do. That's the first thing. The vaccine does not induce a lifelong change. It doesn't induce a lifelong change in our immune systems.
Right.
But those immune systems will not work now. Why are you blaming the vaccine when probably that person who had the stroke had other risk factors? So we're not looking at that individual's risk factors.
But we just try to look at the common denominator.
Yeah, he may have already got atherosclerotic disease, one. Number two, there are also certain things which also happen in these, gymnasiums or health centers. People, I've found that out recently, not recently, but quite often, you have kids coming or children or young adults coming up with complaints. So one thing I figured out is what is happening in the gymnasiums or gyms or these fitness centers is you're artificially given some drugs or some to raise your heart rate. I'm not talking of the performance drugs like steroids. That's a separate thing. Steroids itself is harmful, or your artificial supplements are harmful. So there's another system which I think is one of the reasons why people are getting strokes. They're given this high dose of caffeine to warm up. I was surprised to listen from one of my patients. So he had some strange symptoms, and I asked him. He told me that in the gymnasium he goes and he's given by his trainer this specific thing to raise his heart rate. So you can imagine caffeine raises your heart rate, and those supplements or those drinks which come with high 8% caffeine, which is like 20 cups of coffee concentrated in one drink. So that kind of raises your heart rate to a level where you think you are warmed up, and then you can exercise easily. So imagine somebody already having a heart rate of 200. On a 200 you're doing further exercise like a treadmill. Your heart's gone for a 6. Heart has a capacity. So that probably, I think, is the reason some of the deaths might have occurred because of an abuse of these kind of agents.
What is the right amount of caffeine that you should have before going to the gym?
You shouldn't have any caffeine. Why should you need a caffeine? The normal cup of coffee is good. The caffeine I'm talking is artificial caffeine.
No, that's what I'm saying. Like, what I meant is how much.
In that, but why do you need a caffeine? You can warm up the natural means.
No, like how much coffee should you have?
A natural coffee cup is okay. That's not a very high level of coffee.
Because I know a lot of people do use it as a pre-workout.
So that's not safe. So that one coffee is different than one concentrated caffeine. So coffee is good for stroke. You know that? There's a big research if this is again come from the West. Again, how much of coffee? Black coffee, which the Americans have, been found to have reduced incidence of stroke, especially in women. Those who have at least 1 cup of coffee every day, because Americans have a lot of black coffee.
Maybe they just like brought it up
So
as
there was a big research on this.
okay.
This found, it was found to have a good incidence, good effect on stroke. But that's like a cup of coffee. So a cup of coffee is not bad. It's the concentrated caffeine which I think raises your heart rate to that level,
Right.
which would be very, very risky. And that's probably my take on these abnormal, or I would say these freak incidents happening in the gymnasiums, and they're all happening in the gymnasiums.
Yeah, exactly. All the deaths that you hear about, the young cats, they do.
Nobody's watching on this. I also would not have thought of this, but that's my thought on this since I talked to a few people who had some symptoms. And that's not taken as, there are probably people who have not thought of this.
That makes sense. So, what are some other neurological diseases that you deal with?
So we deal with all disorders, but chiefly my area, which I have over the years moved to, is stroke, which I started, the systems here and set up the stroke pathway in PGI. Is the other big condition which I really got interested is multiple sclerosis.
Okay.
So,
Is it common in India yet?
great question. So it's no longer considered to be absent in India. There was one myth again with, in the 80s, we thought MS existed only in the West, in the 80s and 90s, in fact, till 90s. Even while I was training in 98, there were a couple of so-called MS type patients where we said it can't happen here.
Why not though?
It was believed a disease of the West from the beginning. The reason is if you looked at the original descriptions of multiple sclerosis, they were of course described by someone called Jean Charcot in France in Paris. I was in the late 19th century, 1800s. So that, and then later on, all the descriptions were from the West, and it was believed that there's a effect of the equator. So all the countries which were away from the equator at a certain latitude had a higher incidence of stroke. So India was close to the so it was believed for many years, for a century, India doesn't have MS, which is of course crazy because now we know that it's got nothing to do with, latitude and longitude has got nothing to do with our immunity. It was believed that some viruses affected, although that has also been now come back as a theory. So for all these years, we thought India never had MS. And it is very uncommon. Believe me, it is very, very common in India. We have a full clinic running here. I started a clinic somewhere in 2012 or 13.
And what is it exactly?
So multiple sclerosis is primarily a disease which again, so here is a predilection of a gender. So women are affected 3 times more than men.
Okay.
Younger women between 18 to 30 years.
Oh.
Yes.
Okay.
So that's something very, very, alarming. So that's the reason people should know about it. Because it again affects your prime of your youth, peak of your, career or peak of your life. And if not treated well in time, can really harm or cause a lot of disability. So MS is primarily something goes wrong in your immune system. Within you have your immune cells in the body which protect you from infections, right? So something something goes bad with your cells and they start attacking your own brain.
So it's like an autoimmune.
Autoimmune. It's not exactly an autoimmune because technically it's not autoimmune. MS is not autoimmune because in autoimmune we need to have a target.
Okay.
So we're still not sure where the target is in the brain.
So
it just what it does is it makes a change in your certain cells called T cells and B cells. And it starts attacking the covering of your neurons, which is called the myelin.
Okay.
Which is like the insulation around if you have electrical wires, right?
Right.
So you have an insulation. So that's how we have an insulation around the nerve cells called myelin. And that starts getting attacked by our own cells, right? So they denude it and that's what causes weakness and attacks. So MS comes in attacks, as we call it, or relapses. And then attack can happen at any point of time. So sometimes what happens is it comes as an attack, commonly affects the eyes, can affect your legs, arms. The attack is in the spinal cord, you will have both legs getting paralyzed. And minor attacks cause weakness of one side. and they may just pass off in 1 week or a few days. So that gets unnoticed, and somebody may just pass it off as a minor symptom, and then they do not seek medical attention. And that's the problem. There's a delay in the diagnosis. So these attacks may come again and again, right? But they recover on their own. Initially, they may recover completely, but as time elapses, this do not recover completely and leave behind a residual deficit or a permanent paralysis. That's the problem. So had it been full recovery after the attack, we would not have required treatment. But the residual or remaining disability is the problem. And that's what causes a permanent disability. That's what we need to prevent. So we need to treat the patient or the MS at an early stage as soon as, the first attack happens. And good thing is, and the best part is, we have very effective treatments, and most of them are available in India right now. And they're quite accessible. The accessibility is improved because of the generics coming to India. So at a point of time when the things started, say, a decade or two back, when MS started getting detected in India, like we looked at first few patients too in India, and treatments are very, very expensive. Not many people could afford it. Now they're getting more affordable. Of course, the high-end treatments are a bit expensive, but there are ways the government has quite a few, programs through which people can access these treatments. So the important part is identifying again, just like a stroke, you need to identify MS too.
Are there any early signs for this?
So there are some early signs. Like I said, you may have blurring of vision. And so the early signs are something which we call as symptoms, but they are not an attack. Something like a shock-like sensation going down your spine. They may start happening in the beginning, and they may just bending your neck. Shock may go down your spine, which is called a Leibowitz phenomenon. They may be early signs, but that may be a warning. Or you may have flashes of light coming while you're taking your hot bath. Those are again because of weak nerves. So those are the early signs, but they get missed. If you get people will not, and there's no way to know till the time we do a brain MRI. MS cannot be detected. It goes undetected there's no blood test to confirm MS. So a brain MRI is the reason, and that's probably the reason in India brain MRIs were not very easily available. So for many, many years, we thought that it's not prevalent in India.
Oh, that makes sense. So they could never even detect it.
Yes. So now we are able to detect it quite early, and people do reach to us in good time. Although there are still delays, but they're getting less and less because physicians are getting more
aware
about MS and their treatments. So earlier they were not.
On a lighter note, so many times we have headaches, right? We have headaches and we just think, okay, like it's just a headache. And we either take a painkiller or we take, a medicine just to take care of the headache. Do you think they can lead to neurological disorders when we have like severe headaches?
Well, it's quite relevant. However, it depends on the kind of headache. So occasional headaches we all have once in a blue moon, right? Once in a few months.
And that's okay.
That's okay, but the serious headache, as we call the headache which might need attention, is what we call as a thunderclap headache. Thunderclap meaning something which has like struck you like lightning, something which peaks up in a second. Headaches, what they usually are, they peak up slowly. You have a headache that starts mild, builds up over an hour or two. So that's okay.
Sometimes it even goes away by itself. So
that's okay. You don't need to worry about those. Likely these are migraines, which are again unnoticed. But migraines, if very frequent, again need to be treated better.
Okay.
Not pay for it.
But what is frequent for a migraine?
Yes. So frequent for a migraine is more than 2 to 3 times a month.
Oh.
Yes. If you're getting headaches 2 to 3 times a month, you should seek medical help or at least see a neurologist.
And what could happen if you have more headaches and
Well, migraine is very disabling. Untreated migraines, it's one of the I would say unseen disability.
Yeah.
Migraine is a very big disabler.
Yeah, because you can't really do anything during the whole day. Like if you have a migraine, you have to shut down yourself and just go.
No lights,
No
sounds.
yes.
You're right. So if people stop treating migraine or they treat it with painkillers initially, they are themselves the cause of a worsening migraine.
Oh.
Your painkillers help you only if you have 1 or 2 migraines a month at most. Beyond that, your painkillers are going to make it worse over the...
Because you're going to get immune to the painkiller.
Not only immune, it actually is now been proven that painkillers worsen the chemicals inside your brain, making migraine resistant to treatment. So migraine treatments should be started at an early time with the right kind of medications. And now we have amazing number of not only treatments, we have some devices which have come in.
Oh.
Yes, so we can just put that stimulator here, which we started a meeting last week on this, and that can take care of your migraines.
What kind of treatments are these? Like, are there any home treatments that can be done? Are there any devices at home?
Yeah, so these are devices. So these are devices which are being now utilized. They are taken at home. They're like stimulators, and they're being found to be very effective. So that's been lost in our country, and they've proven, of course, and evidence. They are approved treatments. So they're like small currents which are given. They change the chemicals of your brain, and they are supposed to
EMS.
EMS, you know.
EMS, like the electromagnetic.
No, they're not EMS. There are some stimulations which stimulate some part of your nerve, which connects to your brain and then makes the changes in the brain. So it's not the one which physiotherapists use. There's something they use, some currents to stimulate your muscle. That's different.
And I've also seen those ice caps that you can wear for migraines. Do those actually help? They're all over social media, yeah. So the ice caps that you can wear on your head so that your migraine gets better.
Does it get better? I don't know.
I don't have migraines.
So, that people reported. There is just probably, the ice may just numb your brain and may probably divert the attention from it. But there's I've not heard of it.
No scientific proof.
Scientific proof for that. So instead of, troubling yourself with the ice, which you may not have it in the middle of the day, if you're traveling there, you get the ice. So there are medicines, at least people can take, at least at that point of time. So what we call as triptans, which dissolve in the mouth. So those are the best forms of treatment to treat the headache. And there are some sorts of preventive treatments which we need to give for people with high frequency of headaches. So those need to be taken every day.
Treatment.
Preventive. If you are having very frequent headaches, a preventive treatment is a must.
The younger generation, a lot of us now have brain fog. And literally, that's something that's become so common in youngsters. So what do you have to say about that? What are the things that we're doing so that we have problems like brain fog and early memory loss and things leading to serious problems after that?
So brain fog is something which I also was not aware of. There's something called brain fog. Till the time I heard a lot of the current generation talk about it.
Yeah.
There's nothing we read about brain fog.
It's a newly coined term, I guess. It's the term of Gen Z.
So it's not there in our medical books.
Yeah, I'm sure it's not.
It's away from the medical. So brain fog is nothing but, I think, blanking out, that you are not able to figure out. And one of the reasons I think brain fogging does happen in MS too.
Okay.
That's because you actually have that condition, which is not only affecting your physical abilities, is also affecting, now we know that MS strongly affects your cognitive abilities of thinking, memory, etc. So brain fogging is quite a common symptom. But I think one of the common reasons for brain fog is, again, stressors leading on. And there's so many, multifaceted inputs which are now the characteristic of the current generation. They're getting inputs from social media. They're getting inputs from tons and tons of, sites. And overloading yourself with so much stimuli is probably also, I believe, one of the reasons for brain fog.
So screens,
of course, and stressors. And if brain fog is too severe, then I think one should, like you're saying, memory loss. If the memory loss, one of the reasons memory losses or, skipping certain things in your day-to-day life, stress is a big reason.
Right.
So if you're facing a lot of stress, maybe at work, at home, So it's obvious that you would get these brain fog or memory changes or disturbances. But I think technically or scientifically, brain fog or memory disturbances would be more, they should be of concern if they lean on to your difficulty in managing your day-to-day life. That's how we consider something significant.
Otherwise, it's okay.
Yes, usually these don't interfere with your day-to-day life. Right?
Yeah, but
Something which interferes strictly, strongly in your functioning, like migraine does, that's what should be brought to medical attention. That's probably what somebody is missing at that time.
big fog is just a Gen Z thing.
That's a general thing. You probably get rid of it by going out and walk or something, going out for a walk, take a coffee. So if that is not happening and you're still getting persistent symptoms like memory loss, then of course it should be investigated. Could be anything.
We were talking about brain fog. So let's talk about something more serious now, which is Alzheimer's. It looks like it is on a real increase in India. So, what are your thoughts about the increase in Alzheimer's in India?
So you're right. It's not that it is increasing in India. I think again, it was always there. We were not detecting it.
Detected.
But the other fact, which is a natural phenomenon, which happened in other countries too, is happening in India, which is longevity. So our longevity is increasing,
Oh, got it. Yes.
right? So people are living longer in India, which was not the case. Our average lifespan maybe was 50s or 60s in long time back. Our longevities are going, you would see, in every family, yes, 80s and 90s. So Alzheimer's is directly proportional to the age that you live to. The chances of Alzheimer's keeps increasing by a big percentage as you grow from 60 to 70, 70 to 80, 80 to 90.
Okay.
Due to various multiple factors, not that everybody would get it, but the brain changes which take place because it's a degeneration of the brain, right? There's a deposition of a protein called amyloid, whereas an amyloid keeps getting deposited at different rates in different sets of people depending upon their predisposition. So rightly said, we have an aging population, and that's actually a big concern in India right now.
Right.
So forgetfulness is different, but forgetfulness to a level where you're functioning, which I again stressed upon, your day-to-day functioning is affected, is not normal. So Alzheimer's is kind of a dementia. The dementia is the commonest cause of dementia, and dementia encompasses a number of faculties of the brain, cognition being one of them, and so on and so forth as we define dementia. But cognition and memory is one of the prime things, which make you what you are.
Yeah, can you define dementia for the audience?
So dementia is something, technically, I won't go into the medical definition.
Yeah,
But something which affects significant functions of your brain, more commonly your memory, if you're forgetful about significant things, your way of planning, your way of doing things, even some things like if you're able to carry out work like, making a cup of tea or something, that is also part of your brain telling you how to do it. And if any of these functions, they start deteriorating, and you may be having memory losses and also losing your ways, That's one, very common symptom of Alzheimer's.
Yes.
You lose your way.
I think even in the movies, they always show that as one of the prime symptoms that, people are just so lost, they're not able to find the way to their own house.
Not only find a way to their house, in severe cases, even your way within the house. You may not be able to go to your toilet, you may not be able to go to the kitchen, you will go to some other place and you won't be able to find your way. That's because your brain has a GPS. In fact, the GPS what tells you where is something, what is there, which if people were interested, the GPS system was just discovered a couple of years back, and that person got a Nobel Prize to determine the GPS of the brain.
Right.
In any case, so the degeneration which happens in the brain is permanent. And now, luckily, and why the stress is there, is to detect it at an earlier stage, because now you have treatments which have just been discovered a few years back, 2 to 3 years back to be precise. And those treatments are not the thing which will reverse it, but at least there is a start. And with these treatments, again, very expensive, but not available in India right now, they can slow the process.
Okay.
So that is the reason your detection of Alzheimer's, or which is the commonest cause of dementia, is important. And for that, you need some specialized tests, which are slowly and steadily now reaching India. We do have availability of blood tests and a very important test, which is a PET scan. That PET scanners are there everywhere in India, but we don't have that specific agent which is used to detect Alzheimer's, the isotope, which is a fluoroisotope. That unfortunately is not very easily available in our country, but I have heard from my colleagues that this likely will be available soon in our country. So that makes detection very easy and can help us confirm. So, the problem is you may consider Alzheimer's in a lot of patients, but you may not be able to confirm it. So to start that new treatment, you need to be very sure that you have Alzheimer's, because that acts on the protein that we were talking, which is amyloid, and
Right.
it prevents it from building up faster. It does not reverse it, but prevents a build-up. And that's the biggest thing that you need to do. And at least it's a start. So that's what I said. So now you have things in neurology which are treatable.
That
It was not there 2 decades back.
Yeah. And like we spoke about the symptoms of the other diseases, are there any early symptoms in Alzheimer's that we can detect so that, the person's health doesn't deteriorate?
Yes. So things like a person who's especially, so there are certain individuals who would have a lesser chance of getting dementia, those who are highly educated, those who are very good, adept at multiple languages, polyglots as we call them,
Oh,
multiple languages. That helps you pretty, the higher the education status, the lesser is a chance of you getting early dementia. In fact, people with creative activities, those who are very creative, who are doing like musicians, who are artists, you would
so the more you use your brain, the lesser
so different
chance.
faculties of your brain. Every area of the brain has a different function.
Correct.
When you're talking, you're writing, you're using a different area. You're painting, you're singing, it's a different area. You're playing some skill,
Correct.
that's a different area. So, in fact, one of the ways to people come to us how to avoid dementia.
Dementia. Yeah.
Or, early dementia when they start getting early symptoms. How do we avoid it? The commonest thing, which has also been medically proven, is to tell them to develop a new skill.
Okay.
Maybe a new game. For example, you want to play golf, you want to play tennis, something which you
Can get your brain rolling.
yes, it's not an easy thing to do, especially at an advanced stage. To learn a new instrument, for
Correct.
a musical instrument. So those are things which tell us that if you use a different or a new part of your brain. Coming to the early symptoms, so people who are well equipped or well trained to do something, if they find difficulty in doing that, for example, somebody who's a mathematician, who's a teacher, an English teacher, he starts forgetting things, his words. That's of concern. Something he's done his entire life. So that is one of the symptoms. The other thing is, of course, extreme forgetfulness. What people usually come to us is, one is simple forgetfulness. I forget what I did in the morning, or I forget what I did a couple of days back. That goes to an extreme that he forgets very simple things. Like names are again a common thing which people forget.
Yeah, but that's
That's very common.
Yeah, I mean that happens to everyone.
Yes, but if you start forgetting names of your close family members who live in your vicinity, that's of concern. Someone who's come after a long time, that's acceptable. So things like this, which are out of the ordinary, which may and losing your ways. The first thing they may come up with, I get lost. That's one of the early symptoms.
That's an early symptom.
That's one of the, for Alzheimer's at least. They've gone out and they couldn't figure out, they're driving, but then they've lost their way, which is not common. Somebody who's very adept at finding their way back is unable to find their way back. So these are common symptoms.
Do you think screens have an effect on the neurological systems of our body?
I think there have been studies which show that the blue light of the screens, so the biggest thing it affects is your sleep. And sleep is everything. Sleep goes off, your day goes off. So probably people who are spending a lot of time, especially in the bed, will ultimately land up with poor sleep.
Right.
And remember that sleep is extremely important. That reboots your brain to prepare it for the day. So people who are using a lot of screens do not realize, but they are harming their brain by disturbing their sleep. So in that manner, it may be, and indirectly poor sleep leads on to brain fog, and poor sleep also leads on to cognitive changes, your memory changes, your ability to memorize things. So these are all cycle. People who are stressed, and more stressed, the more you're on the screen. It's like a cycle.
Vicious cycle.
You need to break that cycle. So that's kind of, now we have the screen. 20 years back, nobody had the screen.
Right.
They were better off, I think. They would still go off for exercises.
That's true. I mean, for us, if we want to relax, we go on and watch TV, something like that. But
That's the worst.
when,
And you're watching on the Instagram people going out and doing exercise.
yeah,
That's
that's the irony of everything, is that we're just sitting and scrolling through people working out on Instagram.
why don't people work out on their own? They should be working out on their own. That's, I think, to bring everything back in a circle, working out is most important. Right? Rather than watching people work out, people should their own workout and protect themselves from all diseases.
Yeah, sounds good. I think this was a really informative session, and I think our audience is going to take back a lot from this. So thank you so much.
Thank you. Thank you so much. It was great talking.
Thank you.